Welcome to Areas of Caution in Massage Therapy. Forget tranquil music and gentle hands. Beneath the skin lies a hidden landscape of potential catastrophe, where a single misapplied ounce of pressure can turn healing into havoc. The master therapist moves not just with intuition, but with the grim focus of a bomb defusal expert, navigating a minefield of delicate structures and silent dangers. Cervical spine. Location: the delicate vertebrae of the neck. Within the cervical spine resides the vertebral artery, threading through bony loops. An aggressive twist or deep pressure can dissect this vessel or cause a vertebral artery occlusion, cutting off blood supply to the brainstem. The result is not a kink released, but a posterior stroke, dizziness, loss of coordination, paralysis, even death. You are not a chiropractor. Only to touch the soft tissues is in your scope of practice. The neck is also the home of the spinal cord itself. To treat it is to play Jenga with the central command cable of a human life. Styloid precipice. Styloid process of the temporal bone. Location: the bony, dagger-like projection is in your client's soft spot, just inferior to the ear and posterior to the mandible. Why it is a hidden dagger. This seemingly insignificant spike of bone is the Mount Doom of the head and neck. It is the anchor point for 3 muscles and 2 ligaments, but its true peril lies in what skirts its tip, the internal carotid artery and the cranial nerves. Deep, roving pressure here can irritate or compress the glosopharyngeal and vagus nerves, triggering a vasovagal response, sudden dizziness, nausea, syncope, or sudden, brief loss of consciousness. Impinge on the facial nerve, risking temporary facial weakness or twitching. In rare cases of an elongated styloid process, known as Eagle syndrome, pressure can cause severe, sharp pain radiating to the ear, throat, and eye, a sensation akin to being impaled from within. This is a zone for the lightest, most superficial touch only. It is a neurological lever, not a muscular attachment point to be released. The valley of the pulse, the anterior triangle of the neck. Location: the soft, vulnerable hollow along the side of the throat, below the jaw, and above the collarbone. Why it is a kill zone. Here lies the carotid sinus, a pressure-sensitive switch embedded in your artery wall that dictates the pace of your very heart. Compress it, and you can trigger a catastrophic reflex, a sudden, violent drop in heart rate and blood pressure. The client doesn't sigh in relaxation. They lose consciousness. Beside it runs the carotid artery and the jugular vein, the great highways of cerebral lifeblood. Deep pressure risks dislodging hidden arterial plaque, creating a potential stroke missile. And beneath it all, the vagus nerve, the puppet master of your internal organs. It lies in wait, ready to unleash nausea, vomiting, or a cardiac rebellion. The axillary abyss, the armpit. Location: that dark, sheltered hollow beneath the shoulder. Why it is a treacherous pit? This is not just a patch of sweat glands. This is a nexus. Here, the brachial plexus, the great nerve trunk controlling the entire arm, fans out like live wires. Compression here isn't just uncomfortable. It can cause nerve palsy, leaving the arm deadened and useless for weeks. The axillary artery pulses deeply, vulnerable to occlusion, and lurking within are lymph nodes, swollen centuries of infection, To crush them is to risk spreading disease, like pouring poison into the bloodstream. Antecubital altar, the inner elbow. Location, the sacred vulnerable hollow anterior to the elbow joint. Why? It is a temple of life. Fluids. This soft depression is a ritual site for healers or phlebotomists, for a reason. It is where the veins come to the surface to pray. But beneath those visible vessels lies the cubital fascia, a triangular sanctuary housing the brachial artery as it bifurcates into the radial and ulnar arteries. Deep pressure here is a direct assault on the primary arterial supply to the forearm and hand. A few millimeters away lies the median cubital vein, often massive and superficial, ready to bruise into a horrifying hematoma with the slightest misplaced thumb. And guarding it all, the median nerve passes through, easily pinned against the humerus. This is a zone for reverence, not release. The carpal gorge, the wrist. Location, the narrow passage where the forearm meets the hand, a tight tunnel of bone and ligament. Why, it is a nerve strangling defile. This is not a joint to be cranked or crushed. Within the carpal tunnel, the median nerve, the lifeblood of the thumb and first three fingers, runs in a space no wider than a pencil under the rigid, unyielding transverse carpal ligament. Deep, direct pressure here is not a release. It is an interrogation of the nerve itself. It can exacerbate or even induce carpal tunnel syndrome, causing numbness, weakness, and a creepy, fiery pain that travels up the arm. The ulnar nerve and radial nerve branches also skirt this bony terrain, vulnerable to compression against the carpal bones. The abdominal cauldron. Location, the soft, unguarded belly. The abdomen. To work here without specific training is to play blind chess with vital organs. The abdominal aorta throbs down the midline. The spleen on the left is a fragile, blood-filled sponge, prone to rupture. The liver on the right is a vast, dense factory. The pancreas lies hidden in the depths. This is not a massage zone. It is a closed cavity of vital machinery. Deep work here can cause internal injury, severe bruising, or trigger vasovagal collapse, a brief loss of consciousness. Superior lumbar triangle. Location, known as the area below the 12th rib, a small triangular depression in the back. Why? It is a structural fault line. The lower back triangle is a place of architectural weakness. Direct vertical pressure here bypasses muscle and drives force into the unprotected kidneys, potentially causing bruising, hemorrhage, or extreme debilitating pain. It is a backdoor assault on the body's filtration. The coccyx. Location, the tailbone. Why? It is a crucible of risk. The coccyx is a fused remnant of tail, but it is anchored by ligaments and nerves. Direct pressure is not therapeutic. It is a blunt force trauma to a bone not meant to bear it, causing shocking, radiating pain and possible breakage. Femoral triangle, the groin's deadly crossroads. Location, the deep triangular crease where the thigh meets the torso, bordered by the inguinal ligament. Why? It is the body's most dangerous intersection. If the body had a grand central station for catastrophe, this is it. From lateral to medial, remember the mnemonic of doom. NAVEL, navel. Nerve, artery, vein, empty space, lymphatics. Here, in shocking proximity, lie the femoral nerve, the command trunk for the entire front of the thigh, the femoral artery, the main supply line from the heart to the lower limb. Occlude it, and you threaten the leg. Aggressively compress it, and you risk a dissection or thrombus. The femoral vein, the great return pipe, often the silent harbor for deep vein thromboses. DVT, massaging near it with a hidden clot is like shaking a soda can with a lit fuse. You risk launching a fatal pulmonary embolism. The inguinal lymph nodes, the body's septic sentries. To crush them is to risk systemic infection. This area is absolutely contraindicated for deep pressure. It is a surgical landmark, not a massage target. To work here is to stand at the edge of an anatomical abyss. The political zone, the popliteal fascia. Location, the diamond-shaped hollow behind the knee. Why it is an ambush point. It seems an innocent bend. It is a vascular trap. Here, the popliteal artery and vein, the main supply lines for the lower leg, are pressed deep against the femur, shielded only by thin tissue. Compression here can cut off circulation, damaging the vessel wall, or, in a worst-case scenario, dislodge a deep vein thrombosis, a silent, deadly blood clot waiting in the calf. That clot, once freed, becomes an embolism racing for the heart and lungs. It is a pulmonary embolism waiting to happen. You wouldn't massage a loaded gun. You do not massage a suspected DVT. Bony promontories, medial tibia, ulna, and the ribs. Location, the sharp shin bone, the thin forearm bone, and the floating rib cage. Why, they are blades beneath the skin. These are not muscle, they are edges. To press deeply here is to grind soft tissue against unyielding bone, a recipe for periostitis. Painful bone membrane inflammation, nerve contusion, and extreme pointless pain. The floating ribs, the 11th and 12th pair, have no anterior attachment. They are hooks of bone in a sea of soft tissue. To manipulate them is to risk displacement or fracture. The conclusion: the master therapist does not fear the body. They memorize it. Their touch is informed not by timidity, but by profound anatomical respect. They know that the difference between transcendent relief and terrifying injury is measured in millimeters, degrees, and ounces of force. This is why we take medical histories. This is why we listen for contraindications. This is why training is sacred. We do not just manipulate muscle. We are guardians of the inner sanctum, navigating the mortal architecture of another human being. The privilege of touch carries the weight of potential ruin. Tread with knowledge, respect the boundaries, and let your healing hands be guided by the ghost of every possible catastrophe they are trained to avoid. The power to heal is, in its shadow side, the power to harm. Choose your pressure wisely.